it's time for the Global Health module. So it's an honor for me to introduce the next moderator. Dr. Mariam Klassen is an honorary medical doctor at the Karolinska Institute and really a person I look up to and would like to be like when I grow up. So she has 3 decades of experience with global health and pediatrics, and she's really knowledgeable. She's worked with the WHO, with the World Bank, and she worked for the Bill and Melinda Gates Foundation a couple of years ago when Björn and I and Nils and others planned the immediate mother care study. So an honor, Mariam, and please, welcome.
Agnes, for that very generous introduction, and the admiration is mutual. I must tell you why it's so exciting to be here today. There are several reasons. One reason is that there are so many here. It's amazing to see so many here in person. Of course, it's a little bit surprising that the gender imbalance remain as it is, with a few brave men in the auditorium. The other reason why I think it's very exciting to be here is really what the previous presenter talked about, how the science has pushed the boundaries. How we are now talking about not just early introduction, not just exclusive breastfeeding, not just about skin to skin, but zero separation, which offers really a window for transformative change. So that's extremely exciting. It's also exciting to know and sobering to know that evidence is necessary but not sufficient for change. And that's why it's good to also have the next speakers who will talk about the importance of partnerships. We heard about the partnership at the clinical setting between parents and care providers, but we also need those partnerships to really move into policy change, advocacy, and structural systemic change. And the time is really here now. It's also very exciting to be here today, because in about 2 months, we will have new position paper on kangaroo mother care coming out of WHO, to which many of you have contributed here. And also, even more important than another position paper, is implementation guidelines. How do we take this forward now that we have the evidence? So this is a very exciting time, and it's therefore very exciting for me to introduce Silke Mader and Sunan Rao, who are 2 of those champions who have been there on the frontier pushing the agenda. So Silke Mader was supposed to be here, but Silke, we are so glad that you can join us anyway, even though you are not here in person, because Silke represents those champions who bring lived experience, who bring the experience of forging alliances and partnerships. She did found the European Foundation for Newborn Care, Infant Care, and she also helped to put the World Prematurity Day on our schedules every year, and other efforts that she will talk about, including the most recent GLANCE, the Global Alliance for Newborn Care, and to push that the things we talk about here isn't just a good thing to do, as we've heard, but becomes the norm. The norm. So Silke, I'm very happy to turn the floor to you, and you have the same daunting task to try to summarize your wealth of 20-year experience in 30 minutes. It's not fair, but I will be a respectful moderator and cut you off at 30 minutes. Thank you, Silke.
Yeah, thank you so much for the nice introduction. And sorry to not be with you, but I also didn't want to bring you the virus to Stockholm, and I also want to take responsibility on it. So I would ask the technique to share my slides, and click already on the next one, please. So my situation, well, several of you know me very well, but maybe some of you not. And the reason why I have done all the work, my son is now 26 years old, But I started really in a very challenging situation. I had a HELLP syndrome, preeclampsia, and I was pregnant with twins. And at this time, it was classical, like we all have learned in the pandemic, parents were seen as visitors. And still all over the world, in many, many units, there are still the signs on the door, visiting hours from this to that. Parents are no visitors. And I have experienced this 26 years ago. And I thought before the pandemic, we are moving forward. We are already on the right way. And then came the pandemic. So I experienced on my own life, and my husband as well, what does it mean to be a parent in a NICU and be separated? And this is also why I'm such a champion or ambassador or fighter, however you call me, for really a zero separation, that parents are seen that they are parents and that parents are not visitors and are welcomed 24/7. And so our children were born in week 25 with 515 grams, and Lena had 290 grams, and she passed away just one week later. And I also show you here a picture of my husband, Oliver, where Lucas was already a very big baby. And this was the day on Father's Day, which is in Germany, middle of May. So this was the first time that my husband had the opportunity to hold his son, because it was only the choice between mother or father to hold the baby. And my husband always said, take it for you, because you need to breastfeed, you need to be there, and I can just stand next by. And on this day I said, no, not at all, you have to hold your son. That was the situation at 26 years ago. And just remember, all of you, how it was at the pandemic, and still is. I just had a call yesterday with Bulgarian friends of our parent community, and I said that until today, the parents have, in most of the units, not access to their babies at all, and also the fathers can, even for normal baby, not accompany the woman during birth with a normal baby, not even for preterms. And that's the situation, and I hope that everyone, you here in the room, but also all over the world, are waking up and really looking to the data, what we hear also later from Suman, to share this in the community and act according to it. Next slide, please. What we have done, or I have started really basic in the self-help group in Munich the first years, because I had a deep depression and I felt totally lonely. And then I started really becoming a real fighter at the German Parent Organization for several years. The president, we changed laws for longer maternity leave, for a fully paid follow-up system and a one-to-one nursing system. But then we started in 2008 to found our organization, the European Foundation of the Care for Newborn Infants. And our idea was really to set up an organization where we collaborate with neonatologists, neonatal nurses, obstetricians, midwives, follow-up experts, to ensure that these babies can not only survive, that they can thrive, and that all over Europe, maybe in the future when I retired, or even when I'm older, or maybe in the next generation, will have the situation that all babies born preterm have equal access to care and have a chance to survive and thrive and get us out in this challenging situation as healthy as possible. So our idea was really to start even before the baby is born, to be able to be born in the right hospital, to be cared proper and have access to the right care, and also to the parents access 24/7, and to have support after discharge, because I can tell you, having now a young adult being born with 515 grams, that's really a challenge, and that not stops after NICU. Then it starts for us parents, and for the preemie, in many cases, even lifelong. Next slide, please. What we have established in the meanwhile, we celebrate this year also 15 years, and so we have established a worldwide network in the meanwhile. We haven't expected this, so our name is European Foundation, so therefore we have founded just before the pandemic our initiative, the Global Alliance for Newborn Care, because many organizations out of Europe came to us and asked for joining, asked for support, because outside of Europe there are of course organizations and parent organizations, but not umbrella organizations, organizations who are working with WHO together, with UNICEF and Save the Children, and have the capacity to do it, because working on a position paper, on kangaroo mother care, on the new guidelines, that needs capacities, that needs knowledge, and therefore we are hoping that we can represent the parents in a good way, and we also, of course, join with other parent organizations to give them a voice. And we collaborate with many, many researchers, scientists, neonatologists, nurses, and so on, to ensure that we go in line, that we work together, and that we not have two parallel worlds. Next slide, please. What we are doing is to really combine forces with our parent organization community. We meet once a year physically in the time of the pandemic, and still today we have monthly calls, we have physical meetings, we provide workshops, trainings, to ensure that our parent organizations can do the same work what we do as an umbrella organization in the different countries. And we train in of course, raising awareness, in fundraising, joining research projects. But we also are, this group also founded together with us the World Prematurity Day. At this time, we were only a bunch of people. Now you see we are a huge group, and many colors we have now, where you see that we are working globally. And also in this group was decided to develop European standards of care for newborn health, so that we have access, equal access to care, and also idea of glance was founded in this group. Next slide, please. What really has changed during the last years, seeing us as parent representatives organizations, in the very beginning, most of you and your previous colleagues have seen us as a kind of self-help group, as organizations who help other parents and hold maybe their hand or listen to their stories. But that is only one pillar in the meanwhile. So since a couple of years, parent representatives are demanded to join research projects. We are influencing the health policies. We are quite strong. We have quite strong voices in this level. And we also are working in the research and education programs. And as I told you before, in the research, parent representatives, especially in the European Union, have to be involved, so that's a law, and therefore we work on local and national level in these areas. We work on the European level on these areas, and in the meanwhile also globally, and we are extremely grateful that WHO gives us here such a big space and is listening to us, and also incorporate our wishes and demands into the documents. And you will hear later also from Suman for sure what we could achieve together. We see us really in the meanwhile as part of the team, and especially WHO gives us the feeling as that we are really part of the team and not only a decoration. Next slide, please. What we have, I just quickly go through this because it would be an own presentation, and several of you know the project already. We have developed the European standards of care, and this is something where in the very beginning the people were very against it, because how can parents develop medical standards? How can it be? And it was a big fight that we not only wanted to develop medical standards and only the medical treatment, we wanted that the infant family-centered developmental care concept. But you also, there are many knit-cappers here today. There are also many people who have a fine training, but we really wanted the vision and idea what Björn Westrup and also Pierre Kuhn had at this time to really bring into the middle of this idea. And when you see the next slide, we have 11 topic experts groups where we really put it the baby and the family in the middle, and we tried in all these 11 areas to put the parents and baby's interest really in the center. And so we had a big fight, but finally we won, that we have this concept really around the baby, and everything when you see and look into the standards, this is the core, the center of this idea, and there are cross links, because how can you provide breast milk? How can you provide really proper care when you not have the family with the baby together and see the parents as the main caregiver? The evidence is there in the meanwhile, so therefore it's important to understand how to provide really proper care for this baby, and you cannot exclude the parents. We see it that it exists all around the world, but we also see in the outcomes where really a proper kangaroo mother care concept, where an infant family-centered developmental care concept is implemented in a unit, they have also better outcomes. And this is something where we wanted to share with our community, to provide this knowledge, to look into the different areas of care and put really the baby and the family in the center. And what we have done, we worked 5 years with different experts, so 220 experts from 30 countries to develop the standards. We have already the first revision process behind us. The next one is coming. We are at the moment working on the implementation process. We work on a self-assessment tool and an ambassador program, and we have very good examples like Italy, Portugal, at the moment starts Greece or Ukraine also. They're working hard to implement the standards into their everyday practice, and we work here closely with the healthcare professional societies together, and you see here again 170 organizations have finally supported and endorsed this project. Next slide. In this slide, you see a lot of ideas, what we have developed to ensure, so I don't know, next slide, that you see a lot of bubbles, where what kind of tools we have. When you go on our website, you see that we have a toolkit. As I told you, we work on a self-assessment tool to look in your own unit. What is the status quo of your unit? We work on education programs. We have founded an academy to educate and train healthcare professionals on the different standards, on the different way of treating the baby. We have political activities with call to actions. We work on a fellowship program together with our parent organizations to educate and train them. We have provided workshops that our parents are ambassadors in the country to push the projects forward. There is, of course, criticism that people say, oh, how can a parent organization are doing it? But honestly, even the WHO are referencing our standards and implement in tools like the nurturing care brief our standards. So therefore, it could not be so bad what we have done when even the WHO are referencing it and using our materials to do it. So that's often a criticism from countries where they are not collaborating really proper with the parent organizations. And it is also sometimes that people are jealous what we have achieved, because normally, honestly, it's not the job of a parent organization to develop standards, it's the job of a healthcare professional society. But we also see that when there is not the capacity, why not doing things together? And we see this project until today as a really good example in collaborating, working together to ensure the best care for our children. Next slide, please. What we have achieved is that we could hire Professor Luc Zimmermann, previous president of ESPR and director of the Maastricht University, to our team as senior medical director. And with this achievement, we could also establish an own EFCNI academy, which is targeted to healthcare professionals. Here we develop, as I told you before, different kind of education materials. We develop webinars, we develop workshops. We are part of the CHENS Congress, which takes place in September this year, again, physically, so we can see each other. So we are equal partner. So we are parent organizations who are not only our self-help group, we are really being part of education, training, and pushing the things forward, doing policy and advocacy work to ensure that these healthcare professionals who are still maybe behind our standards get the right information, proper information, be educated and trained to implement this concept in the different countries. And many of our parent organizations are already joining this concept. They are financing and supporting the FINE or the NIDCAP concept. They're helping with tools like buying a PAL, so the doll PAL for simulation trainings. So our parents play here really a key role. Next slide, please. Yeah, you have already mentioned before, we are founder of World Prematurity Day, where we are very, very proud of, because when we started in 2008 to have this idea, people were simply only laughing about us. How can parents found a day? Who will join this idiotic idea? Well, this idiotic idea has in the meanwhile around 4 billion people who are joining every year. Also here, a big thank you to all our parent organizations, you, the neonatologists, the different hospitals, WHO, March of Dimes, UNICEF, who are joining us every single year. And this year we will for sure focus on the kangaroo mother care, because there we have the Born Too Soon report will be launched in May, then also the kangaroo mother care guide and position paper, and also, of course, the zero separation, that parents and babies can stay together. Next slide, please. What we also do throughout the year, and many of you join, are of course different kind of awareness campaigns. We have to do this all the time to raise awareness, because when you not talk about it, people forget it. There are so many other topics around the world every single day where we have to raise awareness, we have to speak up, we have to also not accept everything what people decide. So it's important, and this is also a key role what we are doing, what I'm doing at the different meetings, that I really read proper all the documents. Just at the moment, we are working on the finalization of the different documents in May for WHO. I'm sitting most of the evenings and weekends there, reading it, taking responsibility, giving honest feedback, criticize again when it's not implemented. That's the role, what we have to do, and we hope that also you as neonatologists and nurses and other experts here in the room are helping us to continuously raise awareness on the topic. And that's also why the NITCAP Awareness Day was finally founded, to raise awareness why it is important to educate and train experts in the NITCAP concept. Next slide, please. Why we have founded GLANCE. Next slide, please. The idea of GLANCE is that we really ensure that these children who are born preterm have really a voice. I don't know if it works now with next one. When we just look into the numbers, so that globally, that 5 million, so global numbers of newborn deaths, for example, declined from 5 million in 1990 to 2.4 million in 2019. And approximately 6,700 newborn deaths occur every day. Just imagine this enormous amount of deaths every single day. Why? Why is newborn health not on a really big agenda in each of our countries? Why it doesn't matter in a way like other things? And this is what we also have to ask ourselves, each of you. What can we do to put this more on our everyday's agenda, not in the hospital, I mean on a political level, on a media level? What can we do to shake and wake up politicians to act differently? Next slide, next one. So children really face the greatest risk to die in the first months. That's what we have to understand, that this is the high risk in most of the countries in the world where there are low and low middle income countries. They have the highest risk. Next one. So in 2019, 47 of all under 5 deaths occur in the newborn period, with about 1/3 dying on the day of birth and close to 3/4 dying within the first week of life. Just think about this enormous amount of numbers, what this has. Next one. So children who die within the first 28 days of birth suffer from conditions and diseases associated with lack of quality care at birth or lack of skilled care and treatment immediately after birth and in the first days of life. This is why we also have established the academy, to ensure that the people are trained and know and have knowledge what to do when a baby is born, a normal baby, but especially when a baby is born too small, low birth weight, preterm, or sick. Next one. So preterm birth, interpartum related complications like birth asphyxia or lack of breathing at birth, infections and birth defects cause most of the neonatal deaths. And in most of our countries, they can be treated very well. But in the rest of the world, it's really lacking. Why these children have no voice, and they're also not the mothers? That's what we have to question ourselves also. What can we do to make here change? Next one. So women who receive midwife-led continuous care provided by professional midwives, educated and regulated to international standards, are 60% less likely to lose their baby and 24% less likely to experience preterm birth. So we also have to work together with midwives, with obstetricians, with maybe workers in the different village areas, what we can do to ensure that they get enough education and training. Next one. And that was the idea of GLANCE, to really start earlier, to start already at the preconception care, to start with girls, with women, also with boys and young men, to understand why it is important to give birth in the right hospital, in the right location, so that in the end they have access to better care. And this was in the end the idea, so expand EFCNI to a global level. Next one. So when you think about, we have founded this idea in 2019, shortly before the pandemic started. It was November 19 where we started it, and we have developed a global call to action with a lot of bullet points, and you see here that 170 organizations from various countries in the world have said, yes, that's what we want to do. Next one. And when you see here, we have demanded already that time, zero separation, family involvement, parents should be the main caregiver, parents have access, the parents should be empowered. And all of these 170 organizations have given their logo, have supported it. And then, next slide, came the virus. And then, next slide. Then we had the situation that NICUs, delivery rooms, closed their doors. Parents were again more than not only visitors, we were excluded totally from the units. Women had to give birth alone without a partner, even when WHO has recommended it. They were sometimes even ignoring it, and I tell you, in many, many countries in the world, it's still the case. Next one. So separation, as we all know, and it's evidence-based, harms and helps not the health of the baby and not for the woman. Next one. So the survival benefit of kangaroo mother care, I mean, it's proven since years. Next one. And our parents came back, and it was really a disaster what they have shared with us. Next one. So we developed, first of all, a huge campaign about zero separation, why this hurts, what is the evidence behind. We developed, with the support of our parent organizations and neonatologists, a translation in 27 languages. And again, we had 120 organizations who supported us, but not all of them acted according to it. Next one. So parents, like our French partners, they said, we worked for years for this. But now we are there where we have even started and even before. And the next one, a nurse said then finally that also they suffer because they have to separate the parents with the babies, and they know that this is wrong. Next one. So we provided data and infographics with all the facts and all the evidence, but people didn't change their behavior, even not when we had the mask and the immunization with the vaccines and so on. People didn't stop to separate the babies from the parents, and that was, and even today, we don't know even what we should do to shake these people to change their mind. Next one. Even for kangaroo care, there's a ton of evidence, reducing of neck, reducing of mortality, of sepsis. So breastfeeding is not possible when you not be able to provide the mother's breast because she's separated. And the stress will not help to produce milk. So why you are not providing this kind of support when it is already hard evidence? If it is surfactant, when I just saw the video before, that's not the problem to change. The people are doing the things, but what in hell is stopping you to not provide 24/7 access for the parents when it is so hard evidence? Next one. For the long-term consequence, and also next one, is that also parents are suffering, the health of the parents, the mental health of the mother. That is something and even do you reduce the length of stay, even money is an argument. But why? Why you are not providing this? And we not need a luxury hotel-style NICU for it. It would be, of course, perfect to have a bed and a comfortable chair, but having access to us, to our baby, it costs you no money. Next one. So what we have done then is to provide a study, because when you want to convince researchers and experts, we always have to show the data. Next one. We collaborated with several people, and we also published it from Lancet to BMG to eClinical, so high level. We asked a different question on prenatal care, on the presence at skin to skin, communication and mental health. Next one. So we also have done this in several countries. You see a big gray area. There we have no parent organization and couldn't really access proper. Next one. We showed in this report, you can see the different countries. One example here I show you with Poland, what we have asked there. And you see that 90% of the mothers could not in the end had a partner with them. That around 28% of the parents could not at the end see their baby at all. So they had no access to their baby the whole time in the NICU, the first year of the pandemic. Next one. So parent statements, I just want to let you read them. So one, maybe you click 3 times. So you see here quotes from parents. We also had open questions that I could see my baby for the first time only 1 month after his birth. That is terrible. Of course it's terrible when you not be able to see your child. Or it should be the right of the parents to be with them. And so parents are no visitors. Next one. What we have shown in the BMG publication is the differences between the countries. And you see here in purple that, for example, in China or in Poland or in Turkey, there were a lot of purple where we had that at the end, the situation where parents had no access. And then in Sweden, of course, this is what we also expected it, also in Canada, also in Australia and New Zealand, you see that most of the parents, even in the first year of the pandemic, they had access 24/7 with their children and could touch and could kangaroo with their child. Next one. So you see here that 1 in 5 of parents in the world had no access during the time of the first year in the pandemic to their child. That means every 5th family had not access to their child and saw their child the first time at discharge. My son was 4.5 months there. Next one. So prenatal care support and support at birth, next slide, is that 42% of all participations were not allowed to be accompanied by a support person during the prenatal appointment. And when there was a negative situation or information, then they had to be there alone. So more than half of the responses reported that they were not permitted to have support person present during birth. So half of the women had to give birth alone. Next one. And also in breastfeeding, 1/5 of these parents or women were not really actively supported to provide breast milk or to be supported with breastfeeding, which is also a lot, maybe 18 compared to the other numbers, but even 1/5 get not this kind of support. Next one. Next one. Also in communication, we have learned that 1/3 of the respondents lacked adequate information on how to protect themselves and to provide really the best support for their child in the time of the pandemic. Next one. Next one. And also the mental health situation was that more than 75% of the responsives were worried about COVID. Well, there we were all, I guess, worried about COVID and how it affects ourselves, our families, and so on. Next one. What we have developed then is, again, a call to action for zero separation and infant family-centered developmental care. And you see here, I go not through it because there is a lack of timing, but you see here in one of the lines that we want to establish a zero separation and a family inclusive policy in the hospitals. And we are still struggling with most of the hospitals across the world to be there where they welcome parents again 24/7. Next one. You can download it on our website, but also on the QR code. Next one. And here again, the two different situations. We have this big open bay units where parents feel even not welcome, even when they would have access 24/7. And you see one hospital here, and I'm very proud that it's not Sweden anymore. We have also in Germany, in Munich, and in Berlin, and also in Passau hospitals where we have 24/7 and we have beds and really support like I have seen the first time in my life in Sweden. And this is really evidence-based medicine, what we are providing, what you are providing when you are acting according to this. Next one. So we hear later also from Suman about the WHO guidelines, so I go not too much in it, but I want to show you next one, where we have started the zero separation, and also the next one, where we now work actively with our zero separation in providing this information, pushing the things forward, translating with our parents it in as many languages as possible to hopefully can brainwash the healthcare professionals and motivate the academies to adapt this into their guidelines, adapt this and act according to this new WHO guidelines. Next two ones maybe. Then you see also the other one, the new one with the family involvement in kangaroo mother care, but also the home visits. I'm very proud that we could achieve this goal in WHO with this new recommendation. And we hope with the WHO recommendation, we get more activities in the different countries. Next one. I want to show you these two pictures. One woman where she only was able to see her child on a photo, not having access. Just imagine again. 1 in 5 families had not seen at all their baby until discharge. And you see in her eyes, and you see in the eyes of the couple who are able to bath their baby with the mask. And I hope that many of you now can feel the pain what these families have and still have because they are separated, are not with their child, are not seen as parents, not main caregivers. They are still separated from their child, and this harms. Next one. And I want to close with this presentation with my own son, who is now 26 years old. And I can tell you, still this separation from this time hurts us, especially my husband, who is not able to talk about it, had a deep depression afterwards, and also a tinnitus. And until today, he cannot talk about the situation. It hurts us until today how we were treated. And thank you so much for your interest and for your time. And sorry for the delay, but it was always clicking.
Thank you so much, Silke, for your presentation, and in particular how you have put meaningful engagement of parents and families in the center. And we will, of course, hear about that. And we see that meaningful engagement in the new guidelines that I think Sumandra will talk about. So thank you so much. I don't think we have time for questions unless someone has a burning question. Otherwise, do put it in the Mentimeter, and we will definitely try to loop back to any question that you have. I do have one question for you with one-word answer, Silke. You raised many times during your presentation the question, why? What will it take now to really get the transformational change? If you could list just one thing, one factor that you think is most instrumental to move us from where we are today to full scale up of essential newborn care and kangaroo mother cares for those who need it, what is the one factor that remains to make a difference? One word, please, Silke.
It's education and training of the healthcare professional, and do this continuously. The best would be even to change the curricula of neonatal nurses and neonatologists and obstetrician and midwives.
Great. Thank you so much for your insights. We can't hand over flowers to you, but I hope you feel you get the flowers virtually from us. And a huge hug and a huge thank you and a final applause. And then I think we will see a brief video.